I was reflecting just recently about the responsibilities from a whistleblowing point of view. So, meaning that in every organization, there is a duty or a protection for whistleblowers if you have a concern. Now, it doesn't say the whistleblower has to be correct in order for them to whistleblow, but I do wonder, is this not theoretically a whistleblowing kind of situation? You have a concern, you don't think it's right. Isn't that what we are encouraged in all sectors to do when we see something that is not quite right? Any thoughts on that?
Yeah, look, you're absolutely right. I mean, we've been doing more than blowing a whistle. We've been trying to scream from the rooftops. And of course, you're right. It is, generally there is a responsibility on anybody in any profession or industry, if they see harm or potential for it, that people speak up. And I guess the best known sectors where you would expect this would be medicine, where we have a duty of care not just to our individual patients, but we have a sort of sentinel function, a lookout duty that doctors have always had in their communities, for the first signs of problems. But the other industry, of course, is the airline industry. So there's been this see something, say something culture that has been very correctly introduced to try and overcome the barriers that people might feel to being a lone voice. Now, in the case of medicine, not only is there the fiduciary obligation to, if necessary, stand in front, stand between your patients and, harm that you might see. We are expected to go that extra mile, and most of us learn that early on, or if not, certainly as we go through our careers. But we say that we should have protection also under legislation. And here in New Zealand, there is an act called the Protected Disclosures Act, which should protect employees who go to their employers, or in our case, our regulators, with concerns. And our regulator has, in a way, acted as an employer, because through its guidance statement that it issued in early 2021, and in fact, many medical councils around the world produced a very similar sounding statement around the same time, which said that we expect you to be vaccinated. So, it was the first real sort of vaccine mandate, actually, that a profession in New Zealand was subjected to. But we expect you to be mandated, and you expect you to be vaccinated. And also, you can only say positive things about the vaccine. And the implicit threat was, if you don't, you might lose your job. So we feel that they were actually acting as an employer, and that we ought to have protection under legislation. But of course, that hasn't happened.
It raises an important question, Matt. And I had always said at the beginning of the pandemic, certainly with the mandates and so on, that the reality is that they were putting themselves in a position where they had to be correct, meaning that there was no leeway for error. If there was error, they were going to get absolutely hammered because of it. And this is therefore what has happened. It hasn't worked out the way that they had anticipated. And so therefore it comes back to that question. If there were other clinicians who were concerned, who didn't raise any concerns, are they therefore on the other side of the question negligent in their actions?
Yeah, we may have touched on this last time. I mean, that is a very important question. However, I think you have to have, well, we always have to try and have compassion and understanding, for everybody in every situation. And it's not the fault of most doctors that they were threatened with their livelihoods, having first been, had the pants scared off them by this very overblown idea of this deadly pandemic, this unprecedented global health emergency, as we were all told over and over. And it's not the fault of the majority of healthcare workers, and perhaps even politicians at that time, that they they were beguiled and scared by this story that was projected. However, years on, everybody should have calmed down, woken up and reflected for themselves on all the questions that have been asked since, all the evidence that's come out and the information. And we think the responsibility lies very firmly with with the key decision makers, but that includes our own medical council. So actually, we are challenging them in court next month. Well, in fact, this month, in about 2 weeks, in Wellington. The legality of the guidance statement that they produced, saying get vaccinated and don't talk about the downsides or the fact that this thing has no safety data and is experimental, which actually is the advice that we were given by our medical indemnity insurers that we ought to say. They advise that we should say exactly that in the context of an informed consent consultation. So, the whole situation is very complex, but the fact that the majority still, and I'd say the large majority, are keeping quiet is a reflection more on, human psychology and group behavior and the pressure, the carrot and stick, that was used on the medical profession, rather than, innate failings, of people as individuals, because we're all only human. But medicine has a tradition, or it should do, a history of putting itself between the patients and harm. We have this duty of care that isn't just a nice to have thing. This concept of the fiduciary obligation is very powerful. It comes from equity law, which is the basis for all of our constitutional and administrative law. And it says that, we have this extra burden of responsibility for our patients because they may be disempowered by fear, pain, anxiety, lack of information. And we have huge power. We can remove a lot of this. What's the saying? We can cure sometimes, relieve often, and comfort always. And so that extra power that we have in our interactions, brings with it an extra duty of responsibility, and that should include, well, in fact, it trumps and stands above other obligations, to the edifice of public health, to the sort of political considerations of regulatory boards, and behind politics, of course, there's always money and economics and finance. So, that's been the great failure. We do think that a truck has been driven through the kind of foundations of ethical medicine. And really, we're just trying to continue to speak up for that and speak up for patients, for all of us, actually, even if people think we're bonkers or we deserve what's happened to us, with losing our licenses. We think we all stand to lose, if medicine has changed forever.
It raises a question then. Have you got any thoughts with regards to the very consistent approach across the world with regards to medical councils? Different. I was talking to somebody in Malaysia who is going to be going to court as well in September. Dr. Shetty is also going to be going to court as well. In some period of time. Yourselves, similar things have happened in the UK, in the US, in Canada. What is going on?
Well, wouldn't we all like to know? I mean, we are working very hard to try and find out. And, it is no accident that there's been a sort of lockstep, resistance to what we say is medical tyranny. And you can't just remove a long accepted sort of ethical code from medicine, without really bad things going on to happen, because that's human nature. We all agree that there need to be codes of behaviors and codes of practice. All professions have them, but that's also why we have religion or sort of spiritual guidance, because without any of those basic agreed rules, it gets pretty nasty pretty quickly. And there has been a coordinated attempt to silence dissenting voices for what was very clearly, very early on, and this is the bit that really puts my blood pressure up, not as bad as it was made out. Those of us that have worked a long time, and it's no accident that most of us in NZDSOS, and I think other equivalent groups around the world, are perhaps older and more experienced. So we've worked through seasonal influenza epidemics and other viruses and things, and this was quite clearly really no different in terms of the severity. And all the norms were trashed, and all of these things that had never been done before or had been tried and discredited, like masking, like social distancing, locking up healthy people, ignoring, the demographic that would most benefit from quarantine if they were sick, still needs an explanation as far as we're concerned. And we're still asking questions and pointing these things out because they are a sign of something much more fundamentally wrong, and sort of bigger moves behind the scenes. And one of the memes is show me a conspiracy theory that in the end doesn't have a lot of factual basis for it. And you've only got to listen to the ravings of some of these people, in Geneva, and we all know who we're talking about, or people who crow that they've turned their 10 billion into 200 billion through the decade of vaccines, to kind of wonder, well, look, this isn't just crazy. Throughout human history, bad people have always done really bad things to the rest of us, and I don't see that there's anything any different. Why are we ignoring history and ignoring what we've learned about human nature, and what we see in our own lives all the time? Sometimes there are just bad eggs, and when they have the financial muscle, the sort of the technological weapons, if you like, why wouldn't they make a play? We think this is really a sort of a very important and a kind of battle for the sort of the spiritual as well as the physical soul of humanity, given how many people have been injected, for instance, and the lies we were all told. You've got to scratch your head and decide, how is this relevant to me and my life and the life that I want for my children and the people I care about and myself going ahead? Might this in some way represent an existential kind of threat? Because if it does, and I'm just going to keep my head stuck in the sand, then I'm in trouble. And if these people who've been saying, calling out the problems from the beginning, actually turn out to be right, how can we expect them to work miracles if there's just a few of them and they're on their own? We've all, I think, got to start thinking for ourselves, and as a collective, we could move mountains, but we have to, get our head around the change. This normalcy bias is very powerful in humans. We often get accused of having selection bias, and we only focus on, the negative data. But in fact, if you're looking at a treatment, an experimental treatment that's brand new, any negative data should stop the rollout in its tracks, until its implications are understood. And that's been the norm for a long time. And then suddenly it wasn't. So, this idea that everything's hunky-dory, and normalcy bias, as I say, I think it runs very deep, and it's very